I would like to express my thanks and gratitude to ACP India chapter for having invited me as a faculty and to speak on the subject of dementia. I would like to share the screen now. Yes, the slide is on. I'll put it on the slideshow. So this is an emerging epidemic as far as our country is concerned. It is a dreadful, irreversible disease which has almost taken over the entire world. India is now no exception, where life expectancy is also rising. Why it is an emerging epidemic in India? It is already a pandemic in the West. Worldwide, one new person with dementia every 3 seconds is detected. Prevalence at 65, age is 2 to 3%. And because it is age-related disease, so it doubles every 5 years to reach a figure of 40 to 50% at the age of 90. Globally, persons with dementia are 50 million in 2017, will be 82 in 2030, and will be 152 million in 2050. In India, the corresponding figures are 5 million, 7.5 million, and 15 million with people with dementia in the year 2021, 2030, and 2050. You will see here that over time, if you relate the disease burden according to the age, we will see that the bottom two colors, the deep blue and the light blue, they represent people of the age of 65 to 74. Here, the overtime prevalence or the overtime disease burden is steadily but surely rising as far as up to 2050 is concerned. But the upper four colors represent older ages from 75 to 90 plus. And you will find, as far as the old age people are concerned, the very old age, in the year 2020, from this year, there is a steep rise. And the steep rise is going to cause a lot of problem because by the time the people reach at the age of 85 or 90, lot of their proportions will have dementia. Now, what is dementia? It is an acquired syndrome, and by definition, the person has to be conscious. The feature is mainly memory impairment in most cases, plus at least there should be one of the following. Aphasia, that is inability to carry out a familiar language communication. Apraxia is failure to carry out a familiar task. Agnosia is failure to recognize people, objects, and places. And of course, executive functions are also impaired, like reasoning, thinking, and judgment, etc. In addition, as the stage goes on, progressing, there is an impairment in activities of daily living, and functioning in a social environment is also affected. Now, coming to the clinical aspect, dementia is an umbrella term used to describe a set of symptoms, which I have already said, like impaired memory. There is a perception problem. They are not very clear what are they seeing the world around them. They don't understand, for example, and there is a misidentification, misconception, hallucinations, time shifting, delusions, etc. Plus, they have some problem with attention impairment, reasoning, judgment, thinking, and language I've already spoken. And finally, it must be severe enough to interfere with a person's ability to function. It leads to frustration, anger, depression, progressive, disease irreversible, and there is no cure, and death is certain. This is the healthy brain versus Alzheimer brain. On the right side, the Alzheimer brain shows atrophy, decreased size of the lobe, and there is a ventricular dilatation. The histological changes in the brain on Alzheimer's side, there are intracellular structures called neurofibrillary tangles. They are composed of tau proteins, the phosphorylated tau proteins, while amyloid plaques are the intercellular structures which disrupt the communication between the axons in the brain, and these plaques are composed of different protein which is called amyloid beta protein. Dementia happens to be the highest disability after blindness. These are the figures from our country, and the, the proportion to which dementia can contribute to disability amongst all the chronic diseases is 11.9%, which is only second to blindness, which is 21.9%. And the number of years which are spent living with disability in people with dementia is about 7.4 years, which is again only second to blindness. As a whole in the world, there were 46.8 million people with dementia as of 2015, and in 2022, that is today, there are 55 million, and they are set to rise further and further. The individual figures relate to the number of dementia patients in different regions of the world. As far as the people with dementia number is concerned, if they are depicted year-wise or decade-wise, you will see that they are progressively rising. And by 2050, we'll have about 14 to 15 million people with dementia in our country. And this is directly because of increased life expectancy and increased population of older persons. This is a comparison of disease burden of persons more than 60 years of age between India on one side and UK and USA on the other side. And you will find that India is overshooting the mark. It has the higher number of people with dementia, and this will continue onwards. The figures are shown here up to 2050, and this is again because of the aging process and increased number of population of older persons in our country compared to the other two countries that I have shown in the slide. How to recognize dementia? Important because it often overlaps. In its early stages, it overlaps with normal aging people. So there are three categories of symptoms: cognitive decline, behavior problems, and activities of daily living. The cognitive decline manifests in the form of forgetfulness, misplacing objects, difficulty in recollecting phone number, recognizing people, and confused about time, date, thinking, etc. They cannot take decision. Behavior problems are repetitive speaking, frustration, agitation, depression, etc. And they wander, they lose their way. Activities of daily living which are affected and impaired, like personal hygiene, taking a bath, or dressing himself, eating or feeding himself, and toileting, they're all affected in the cases of dementia. So, how to differentiate between normal aging individual versus individuals who have developed dementia, particularly in early stage? Normal aging is accompanied by occasionally forgetting the date, time, or friend's name. Any of us can forget it sometimes. Dementia patient not only he forgets, he even forgets that it is morning, noon, or evening, or not even recognize a friend. The second difference is that the normal elderly people often remember the name of misplaced object. But in dementia, people do not even remember the name of the misplaced object. Thirdly, the people who are normally aging, they are able to carry out their activities of living normally, and they observe social etiquette in social environment. But patients with dementia, they are no longer able to perform ADLs and do socially unacceptable acts. There are other peculiar and unique characteristics. For example, the people with dementia wear the clothes wrongly. They sometimes wear a woolen clothes, in summer woolen clothes, not knowing what a toothbrush or telephone is meant for. They can place an empty cup of tea in the fridge instead of a wash machine. And sometimes, because of the visual perception impairment, they fail to distinguish between carrot and radish. So there are four major types of dementia. Alzheimer's, which is the commonest. Next common is vascular dementia. Third is Lewy body dementia. And last is frontotemporal dementia. These are briefly the features of various kinds of dementias. Alzheimer's disease is a slow onset. Memory problem is early. They have apathy, depression, and as I said, they have histological plaques and tangles deposit in their brain. Vascular dementia is post-stroke, whether it is a single stroke or diffuse lacunar infarcts. They have a little less of memory problem in the early stages, and the progression is stepwise. Lewy body dementia, here the memory features are late, fluctuating course is seen. They often suffer from hallucinations and delusions, and they are associated many times with Parkinsonian features. And the reason for that is there is a deposit of a special protein called alpha synuclein in the brain of these patients. Frontotemporal dementia is the fourth one, late feature memory again, but there are personality and behavior changes because frontal lobe is involved, so their personality is disturbed, and they also do acts like disinhibition in public. And of course, I must remind everyone that more than one type of dementia can be present in a particular individual that becomes a mixed dementia. Only 10% of dementia are due to reversible or treatable causes, and I think physicians should be aware what these causes are, but because they can be treated. And the common ones are listed here. I'm not going to name all of them, but thyroid deficiency is one of the common ones. Vitamin B12 deficiency is common. Chronic hyponatremia, normal pressure hydrocephalus. These are some of the causes of reversible or treatable causes. Now, who is at the risk of getting dementia? Head injury, like in boxers, low educational levels and intellectual activity, particularly from the early stage of development, physical inactivity or sedentarism, obesity, diabetes, hypertension, air pollution, depression, socially isolation, alcohol, tobacco, and hearing impairment. They are all modifiable risk factors. But there are non-modifiable risk factors, increasing age, as I told you. Female gender has little more of dementia compared to male. Family history and genetics sometimes are the non-modifiable risk factor because a small percentage of dementia run in the family have genetic basis. Down syndrome is more susceptible and vulnerable to getting dementia, and ethnicity. Caucasians have lower risk than the blacks. Now, I want to just tell you three terms. One is age-related cognitive decline. This is very much part of a normal aging. It may remain stable for years. I think every or most of the individuals, as they age further with advancing age, they tend to forget, they have less of attention and concentration, so on. But then there is a condition called mild cognitive impairment. This is a minor neurocognitive disorder and it is staged between normal and dementia. It may or may not pass to dementia and may even revert back to normality. So this is the intermediate stage. It's something like preclinical stage. The third is frank dementia. It is a major neurocognitive disorder, normally irreversible, untreated, progressive, and results in death. So it is a horrifying disease. And we do not have much of the pharmacological treatment for this disease as of today. So therefore, the prevention is the key to the management of dementia today. So how do we go about? So we have to carry out a screening and diagnosis among elderly people, and there are many screening tests. I am not going into the detail. MMSE or HMSE, that is Hindi Mental Questionnaire, and the lab tests are done to rule out any reversible dementia because that is treatable. And finally, neuroimaging and biomarkers. Now, this is the current summary of biomarkers as it appears in the World Alzheimer Report 2021. I think there are some beautiful biomarkers as far as the imaging procedures are concerned. There are also reliable biomarkers as far as CSF is concerned. But both the imaging and the CSF, that is lumbar puncture, they require some kind of infrastructure, and CSF lumbar puncture is an invasive procedure. So in order to have a widespread screening, it is being explored if we could have some simple blood testing which could reveal some biomarkers, and considerable progress has been made about it. Although not really, the blood biomarkers have not really reached a widespread commercial stage to be exploited for the early use and early detection and screening of different kinds of Alzheimer's disease. Now, coming to the imaging, there are three procedures that can be employed: MRI, CT scan, positron emission tomography, and single photon emission uh, tomography. MRI is good for finding out the neurodegeneration, but it doesn't find what kind of neurodegeneration, what is the cause of it. It is dementia or something else. The amyloid and tau imaging can be done by PET, and this will be very useful for finding out whether Alzheimer's disease is present or not, because both amyloid and tau imaging will be positive in such cases. There is another test called deoxyglucose metabolism. It shows hypometabolism in cases of dementia, and it is a supplementary help to imaging procedures. Then there is a dopamine scan called DAT scan, which is carried out with the help of a spectrophotometer. That is another good method to find out if there is some kind of dementia. In the CSF and blood, there is a ratio of AB42 oblique AB40. AB42 is a very harmful substance. It is an amyloid beta protein, but it alone doesn't give much information. But a ratio of 42 to 40 is a good test, and it is very important for the diagnosis of Alzheimer's disease as far as the CSF procedure is concerned. It is not that much developed as far as the blood biomarker is concerned. The next is phosphorylated tau or total tau protein, which can be done in CSF, which are also being tried in the blood. And the whole background is that we are looking for good blood biomarker. Then there is another biomarker called neurofilament light chain and GFAP. Both are increased in cases of Alzheimer's disease, but they are not as valuable as AB42 oblique AB40 biomarker. Now we come to prevention of dementia. How do we prevent dementia? I think because of the risk factor that I have enumerated, and because of the brain problem that I have already illustrated, I think this can be divided into physical health approach, cognitive health approach, and emotional and spiritual health. Physical health, nothing very technical I am talking, but we have to control diabetes, blood pressure, cardiovascular disease, cholesterol, and other morbidities. So we have to resort to our usual practice of eating right, exercising well, maintaining weight, and abstinence from smoking and alcohol. Cognitive health is all about brain challenging. If we keep our brain active, we will do good ultimately. If we don't use our brain well or not frequently, so there is an old saying, use it or lose it. So these are some of the methods that I would recommend for keeping the brain active over the life course. Accomplishing new tasks like reading, learning music, assembling gadgets which you might have purchased in a box, befriending grandchildren, playing with them, playing some indoor games. And if you use a procedure like knitting, for example, females often do knitting. So both dominant and non-dominant hand is utilized. So both lobes are stimulated. Explore the internet for online shopping, for paying the bills, for income and property returns. In the beginning, you might have some frustration in old age to do all this, but if you continue sticking to it, your brain will remain active. Fun with puzzles and crosswords, gardening, including planning a garden in your house or outside your house, is challenges your brain. Healthy humor and jokes, and imbibe a new language. So this benefits brain cell regeneration and improves memory and cognition. Emotional and spiritual health, this is mediated through various hormones, neurotransmitters, and it also reduces anti-inflammatory agents. There are four categories of such kind of health: intrapersonal, interpersonal, environmental, and transcendental. Intrapersonal is meant for both persons with dementia and their carers. And this, if we carry out yoga, pranama, and meditation, etc., it will inculcate spiritual traits like forgiveness, optimism, gratitude, empathy. And this, in the long run, will, will be good for preventing dementia. Interpersonal, by interacting with other people based on social interaction and outdoor activity during the life course. Environmental, by citing symbols, they may be religious symbols, colors, watching and witnessing nature, hearing the music, touch and smell, incense. All are non-cognitive pathways, and these are useful even for people with dementia in advanced stage. These are the senses, but they are non-cognitive pathways. And finally, transcendental, by relating self with something beyond human. That means if a person does meditation or other contemplation methods like Tai Chi or Zen or Qigong, they are likely to be preventing dementia in their old age. The words which I have underlined, empathy, social interaction, outdoor activity during the life course, and again music, they are, these concepts are underlined also in the World Alzheimer's Report 2022. So they have some scientific basis. With this, I come to the end of my presentation, and thank you very much for your patient listening. I'll be too glad to engage for floor discussion. Thank you.